Hey everybody, Dr. Steph here again. We're getting into the chapters of my book, The Disc Repair Blueprint. First installment of my synopsis of the book. So hopefully I can help you. Definitely if you're in Chicago and your discs need some repair. If you're not in Chicago, I'll give you some information and hopefully find somebody for you to get this help. So I love the subtitle of my book because it says it all. A plan to overcome spinal pain through cutting edge technology and old school wisdom, no surgery required. It's amazing. That's amazing. So when we get into the first chapter, the first thing I talk about is me. So if you don't know this about me, but I've been in practice since 1994. That's when I graduated chiropractic school. Do the math. It's 31 years. It's crazy. I've been in this practice that I'm in now for 29 years. And I have, a wide gambit of patients that I see in my office. I have a functional medicine integrated practice. So there's chiropractic, there's functional medicine, which is nutrition based, not pharmaceutical based, and I have DNA based weight loss as well as mental health. So really looking at the whole person. And as I've dug into this, I've really realized that there was an aspect of my people, I'm 59. I started this podcast 10 years ago. My people's discs are wearing out. And this technology, this book, the impetus for doing it and writing it was really that I have people that are now, 10 years ago, I was talking about people heading into their 50s making dumb life decisions. Now we're talking about 60s and they're start talking about surgeries on their spine and uh, that's something you want to avoid at all costs, right? I mean, if it's needed, it's needed. But let's try every other thing aside from opiates, every other thing that can keep you in the body that you are without starting to muck with those joints, those bones, those discs in there. So I want to talk to you a little bit about the why. So that's one of the why. The other why is that, when we're talking about discs, so I want to show you this picture. So this is a lower back lumbar spine. Let me turn it this way so you can see this little red spot. So this is the left. So these are the vertebrae. I'm looking at my computers over there. Sorry. These are the vertebrae. These are the discs. The vertebrae are the structure of your spine. The discs are your shock absorbers. So as we age, we can do a couple things. We can herniate a disc, which is right there, that little red thing where we injure the discs and like a jelly donut, that jelly from the middle of the disc squirts out and presses on a nerve. We can do that. And that, is a disc herniation, a slip disc. In the book, I get into more detailed about all of that. But just know that's an event. Boom, boom, boom. That happened. You lift the refrigerator, you do the thing, and boom, you feel it. What I find a lot of at my age is arthritic discs. So that this disc or this disc, which are the two most common, L4 and L5, where over time and decades of injury, these get drier and drier and thinner, so that this hole where the nerve comes out of gets more and more closed off. So it's like this. If this is the hole, it's called a foramen. If this is the foramen, hello. If this is the foramen that it's coming through, then the nerve should be in here and there should be a lot of room. Why is there a lot of room? Because the disc is big and squishy. And if the disc is big and squishy, that allows there to be a lot of room right there. What happens is as that disc narrows with arthritis, that hole gets more compressed and that nerve bumps around and it's much easier. And so anybody will tell you that when these things happen, that you're going to have an experience of, my back used to go out. I would have a thing every couple years. Then it was every year. Then it was every 6 months. And now it's, Now it's not ever really leaving me. So it's degenerating. So our job here is to catch it before it gets too far gone. Okay. Now, in this part of the book, I talk about what I talked about in my first book, which is the pickle. So I'm going to give you the analogy here. And the analogy is that when you get a cucumber and you want to make it into a pickle, what do? You put it in the brine, right? And you put it in the brine and you can pull it out, still a cucumber, put it back in, pull it out, still a cucumber, put it back in. But at some point, that cucumber is going to turn into a pickle. And once you have it turn into a pickle, there's no going back to a cucumber. So the discs are the same way. While we still have disc tissue, while we still have something to work with, this is where this magic of spinal decompression, non-surgical spinal decompression comes in, is that if we can pump these discs, if we can get fluid back in them, will they be like they were when you're 15? No. Will they give you some space and stop the decaying process? Absolutely. And so what we're talking about here is we're talking about really using what's called a spinal decompression machine, or it's a table that's computerized traction to take those discs and pump them and actually suck the fluid back into that disc using some supplements to keep it there. And over time, I have seen pre and post x-rays. Like what I say to my patients is like this. Like if I had my dream, I would take an MRI, I'd put them then through the course of care, and then I'd get a post MRI and we could document the change in this whole thing. Well, I don't think they're going to really pay for that. And I don't want my patients to have to pay for that. I do take pre and post x-rays. And I have my little measuring ruler out, and I see, not only do I see more hydration in the disc post a course of care of decompression. What is that? Everybody's different. Everybody heals at different rates, and everybody has more or less damage. It's their own experience. I see more hydration, which shows up as a darker disc rather than a lighter disc. So that's a good thing. And then I also see more space, bigger disc spaces. So that's telling me that that disc is actually rehydrating, plumping up. Like, the dehydration is changing, the water, which is the cushion in the disc, is getting in there, and it's staying more readily. So all of those things are, again, it's been amazing. Like for me, so many people have been going that go down this road. They give, for one, if you have 30 days of chronic pain, there's a depression, a physical, psychological connection, and there is a depression that goes with that. And so that alone, whoop, if we can calm that down, that's great. Also, if we can get this to heal on its own and have a tool to keep it that way, that will keep you from surgeries, keep you from opiates. I mean, this is one of the ways that people go down the crazy rabbit hole, is they have spinal pain and they're given an opiate that is meant to help with the pain occasionally, but it's just, I don't know. I'll just use another analogy. Unfortunately, like if you put 10 people in a room and every day you give them alcohol, at the end of a month, you're not going to have 10 alcoholics, right? You're just not. But if you put 10 people in a room and give them opiates, you will have 10 opiate addicted people. It's that strong. It's really in the same class as heroin, as cocaine. Like, so anything we can do to keep people off of that, the better, for sure. So I'm so glad you're listening. I'm so glad you're on this journey. We're going to get into it more and more of the details of all these different parts, but just know there is help out there. If you're suffering, you can contact me, contact my office, Dr. Mage at drmage.com, or contact my office. I will help you find somebody in your area, and hopefully we can turn this ship around and help those discs get nice and squishy. Anyway, thanks for listening, everybody.